Hello, everyone. Hello, hello. Good evening. I see a lot of familiar faces. Thank you guys for joining us. This is actually our first webinar of 2025. So thank you for being part of this. Okay, some people are still coming in. Let's give everyone about one more minute and then we'll start we'll start with the introductions. All right, so let's get started. For those of you who are new here, my name is Dr. Monica Gilbert, and we like to do these webinars at least once a month because we love sharing useful information. We love hearing from our community, and we just love doing this stuff. Today, I have two facilitators with me, so I won't be by myself. You guys won't just be hearing my voice. Let me allow them to introduce themselves. Jen, do you want to go first?
Hi guys, my name is Jennifer. I'm the program coordinator here at Crystal Minds, and I'm happy to be here.
And thank you, Jen, for joining me. And we have Karina, and this is Karina's first time here with us.
Hi everyone, my name's Karina. I am an RBT with Crystal Minds New Beginning, and I am happy to be able to share and talk with you guys about autism and ABA therapy.
Thank you, Karina. Thank you for being here with us as well. All right, so let's get started. Let's get started. I know some people come in after, so that's fine. By the way, if any of you have questions, please put it in the chat. I am constantly looking at the chat so I can respond to your questions. So please, please, please put any questions that you have on the chat. All right, so let's get started. Today we're going to speak a little bit about ABA therapy for autism support. And we're going to start with a true and false. But before we get there, let me tell you a little bit about the services that we provide. So Crystal Minds New Beginning provides several services. We do ABA therapy in our office. We do ABA therapy out in the community, in the schools. We also do mental health psychological services. So just individual therapy, group therapy, and also psychoeducational and psychological assessments. And we also provide parent and teacher consultations and coaching. So, and we repeated it again because we have to emphasize how important parent coaching is. So we definitely provide that. Jen is our program coordinator. Jen, can you tell us a little bit about the service, the different groups that you facilitate?
Yep, of course. So we have for all ages. We have for adults, which would be our Monday groups. It's called Rise. We have our preteen and teen groups that would be on Tuesdays, and then we have for all ages on Saturdays, both in Broward and in Doral.
Thank you. Thank you so much. And by the way, I see some Montessori teachers here. We will be presenting on Saturday in the conference. I'm not sure if anyone's going to be there. If you are, just kind of raise your virtual hand over here in the meeting chat. And if you see us around, please come chat with us. We're super friendly. So, okay, perfect. Let's get started. So, let's go over our first true and false. And if you are able to, please put your answers in the chat. So, first true or false. Autism falls in the category of neurodevelopmental disorder along with ADHD and ID. What do you guys think? Is this true or false? What do you think, Karina and Jen? Okay, I see a false here. Let's see. I see a false. How about you, Karina? What do you think, Jen?
I think it's false.
Okay. How about you, Jen? Okay, so I see false, false. I see a lot of falses. Okay, so the answer is true. So autism is part of a neurodevelopmental disorder. I know a lot of people don't know this part because, this is basically what we have in our DSM, which is what psychologists use to provide diagnosis. And why is it important? It's because this is like, let's say a box, right? Neurodevelopmental disorders is a box of perhaps, these different, we can say it's a box of these different disorders that make part of it, right? So we have attention deficit hyperactivity disorder, we have autism, intellectual developmental disorder or intellectual disability, and under this umbrella of neurodevelopmental disorder, and again, neurodevelopmental means that it starts from a very early age. So, from baby years, it's not something that you acquire after. Specific learning disorder, motor disorders, and communication disorders are also part of this. We're also going to talk a little bit about social pragmatic communication disorder. If anyone knows what it is, please put it in the chat. But that's a disorder that is a little controversial. All right, you guys are ready for the next true or false? Let's see. All right, autism is a new fad and everyone is now diagnosed with autism. What do you guys think? Is this true or is this false? Is everyone just getting this diagnosis? Okay, I see a false, false. That was quick. False, false. Karina is like, she's saying no. How about you, Jen? Yeah, so false. Okay, so everyone is basically saying false.
But a
Let's,
lot of people would argue with you if you
huh?
said that.
That
A lot of
what?
people would argue that,
A lot of people would argue.
unfortunately.
What have you heard, Jen? What have you heard about, this thing of like autism being a fad?
I hear it from old school type of people usually. I don't want to throw anyone out there. But it's usually that they're like, oh, that back in my day, that didn't even exist. Or like in Spanish, they're malcriado. They're just like a bad kid, or it's the parents' fault. There's so many ways that they go about it. Like it can't just be like, hey, maybe they do have a disorder. No, 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 it's everything else but.
And I feel like everyone always blames the mother, right? Like, oh, it's the mom's fault because of this, because of that. Like, why, guys? Okay, we have a comment here. The problem is people know better now how to recognize the diagnosis. More education about it means more diagnosis. Absolutely, more awareness as well. I think like, when I started in the field, like I'm gonna date myself now, but like 20 years ago. And I used to talk about autism. Like people had no idea what autism was, right? They were like, what? What is that? And I would have to explain it. And nowadays, I feel like everyone at least has heard about autism, right? Which I think is great. There's more awareness and I think more acceptance as well. What do you think, Karina? Is that have you heard people say that autism is just a fad?
Yes, unfortunately, I have heard that. And I heard someone say, oh, we all have a little autism within inside us. I'm like, not true because me, myself, I have an actual diagnosis. And there are actually symptoms of this diagnosis. Just because you have one or two symptoms of something does not always mean, oh, I have autism. I feel like you need more awareness and actually get a diagnosis from a doctor before anyone makes assumptions.
That's the key word because you see that a lot on TikTok, Instagram, any social media. Now it does seem, hey, everyone on there, they'll say, I'm part of the community because I am. And the only thing that they know of is other people saying, oh, I'm anxious or I don't like eye contact. Immediately, autism.
Yeah.
Did they see someone for it? Did they go to a doctor? Absolutely not.
Yeah, that is true. And I wonder, Karina, when they say, "Oh, I have a little autism," and then when you kind of disclose, like, "Hey, like, I have a diagnosis," like, I can just imagine like their face, like, "Oh, I'm sorry, I didn't mean that." Anyways, yeah, we have to definitely watch our words. So, all right, I like this. It says there was no autism diagnosed before 19, oh, sorry, yeah, there was no autism diagnosed before 1930s. Pluto wasn't discovered until 1930s, but I'm pretty sure it was there this whole time. Right? So just because there was no awareness, that doesn't mean that it didn't exist, right? There was just little awareness and people really didn't know. And I remember back then, a lot of doctors were even scared to give the diagnosis. Robert Tushman was the only neurologist that would provide the diagnosis just because everyone else was scared. So things have changed. All right. So, as Karina was also saying that you need certain symptoms, right? Certain symptoms that have to be happening at the same time in order for you to get the diagnosis of autism. So it's not just a little bit here and a little bit there, and I have a little bit of autism here or there. No, you need these symptoms, right? So the core symptoms are basically like difficulties with nonverbal communication, right? So difficulty understanding perhaps jokes, difficulty expressing yourself. What else, Jen and Karina, can you talk about in terms of like the social communication that we see in autism and also the things that we do with our kiddos to help them with ABA?
So I feel like autism, it's also sometimes hard for the kiddos to describe how they're feeling. They have no idea how to express how they're feeling or ask for what they want, especially those who are nonverbal. So then in ABA, we teach them other forms of communication. For example, we could use like a PECS, like a picture book, like, oh, I want to eat, or a device, or a sign language, or we could even use echoics, different ways for them to try to come across of trying to say what they want to say. But it can be very frustrating sometimes, especially if they can't use their voice. But as ABA, we try to use alternative methods to communicate.
Absolutely. So,
And you know what makes
yeah.
that harder, I think, is that now no one says what they mean. So imagine taking everything so literal and then it feels like everyone is talking in code.
Yeah,
Like,
I had a kiddo tell me, I think it was this week or last week. He's like, I don't understand why people say I feel blue. Why would you say that you feel like a color? And then what you really mean is that you're sad. Why don't you just say sad? Why do you have to name yourself a color? I don't understand, right? Like he was so frustrated. I'm like, you know what? You have a point. Like, why do we say that, right? Okay, and someone put here isolation, lack of reciprocity with others, and lack of boundaries. Well, sometimes we see that as well, right? So isolation, and I think the isolation can be one because maybe naturally they just want to not play with others, right? And two, it may be because maybe they don't have the skills necessary to play or to hang out with other people, right? So that's why we use ABA or these type of therapies to help them learn how to, socially like mingle with others. And then when they get older, it's up to them whether they want to use the skills or not, but at least they have these skills, right? Which is the important thing. And then the second part of the diagnosis is repetitive behavior. So these restrictive, repetitive behavior, these fixation with certain things. So these are things that we see a lot, right? And today I was actually speaking with a parent about it, and they were telling me, well, my child has this fixation with something. And I was like, and I asked them, I'm like, well, is it getting in the way of making friends? Is it hurting them? Is it? And they're like, no, it's not really getting in the way of anything. And I'm like, okay, who cares? Like, who cares? Let them have the fixation if it's not getting in the way of their life. So I think that as a society, we have to learn that, to do that because we should only be tackling behaviors that have that socially significance. What do you guys think?
Absolutely, I agree. If they're just having fun and they're just stimming to a show or they're stimming to something they like, as long as there's not a task in front of them, it's not preventing them from doing a task. I mean, who cares? Let them be happy. I like seeing my kiddos happy. It makes me happy. So
Absolutely.
who cares?
I feel
Absolutely.
like most of that is it's a problem with parents.
Mhm.
because it's like, oh no, 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 no. Like they're probably scared of doing something in public that they think is embarrassing. So I feel like they're just putting that on the child, like, oh no, no, no. Like I don't want anyone to judge you. But do you think they care? Absolutely not. They're stimming the little hearts out. Busy being happy to care about what anyone thinks. Like
Yeah,
genuinely, if they're like, if you want them to be happy and that is your goal and they're not hurting themselves, they're not hurting anyone else, why not?
absolutely.
Right.
Absolutely. Absolutely.
Like,
And I think if you're a parent, right, and this is like no judgment, because I do feel like there was a parent that told me, I'd say they're like, I feel like ABA always blames the parent, and I'm like, you have a point, right? Like, I mean, we're not doing it on purpose, but I think the way we come across, it's a little bit like that. But if there is a parent that you feel like this, like you see these stimming behaviors or whatever, and you're like, oh my gosh, I don't want others to stare or whatever, and you know that it's mostly because you don't want that for yourself. I think that being aware of that is like the first step, right? Like being aware of that and then being able to like redirect yourself too. Okay. So we're not trying to blame the parents, okay? We're just we really want to help when it comes to that because we see, how it does help when everyone is more accepting of these things. The last thing that I will say about the autism diagnosis is that there are 3 levels. So before we didn't have this, now we see this a lot. So level 1 is requiring support. Level 2 is requiring substantial support, and level 3 is requiring very substantial support. So those are the 3 levels. And I guess this is a little controversial. Sorry, someone wants a hug. That's what happens when you do this at nighttime. All right. My kid's going to sleep. Anyways, so I think these levels are a little bit controversial because, I think that kiddos, and I don't know about you guys and Jen, you've seen this too, but they can start at level 3 and then with ABA therapy, we see them move into level 2. And because also the levels are based on the support. So it gets to a point where they don't require so much support. I don't know. What do you guys think?
I see that all the time. Yeah. It's our job to work ourselves out of a job. And so if we need to be there, the full 30 hours, we're there 30 hours. But the point is for us to make them as independent as possible. And
Absolutely.
a lot of times we do get there. We get attached and we're not supposed to get too attached, but we get attached anyways. And then we say, oh, so you are getting better. And then you teach them how to speak. And what they're saying is like, I need space. And then your heart breaks.
Yeah.
So they don't need you anymore.
Yeah. Yeah.
I agree.
Absolutely.
Yeah, we do want to teach the children to be more independent. Just because they have autism does not mean they can't be independent. And then when they grow up and get older, they'll be able to do more things by themselves, the daily living skills and thing that ABA taught them. And then they won't need us as much anymore. And I agree with Jen, it's sad, especially
Yeah.
if you've been with them for many years or a while. But that's our goal, to make them as independent as possible and not need us as much.
Okay, awesome, awesome. All right, next, true or false? Asperger's, let me see, Asperger's and NOS are no longer part of the ASD diagnosis. So what do you guys think? Like, what happened to Asperger's and PDD, NOS? So what do you guys think? Is it part of the Is it no longer part of the diagnosis? I see a true. Let's see. What do the rest of you think? Okay, true. Okay, so let's see if it's true or false. So just so you guys know, back in the day, we had all of these, we had like the full umbrella of these different diagnoses. I don't know if you guys remember, but we had autistic disorder, we had PDD NOS, we had Asperger disorder, we had child disintegration disorder, and Rett's disorder. Child disintegration disorder and Rett's disorder got moved into the medical diagnostic, manual, and then what happened now in the DSM-5, well, now we have the DSM-5 TR, is that they kind of joined a lot of these like a lot of these symptoms into one diagnosis, which is autism spectrum disorder. And actually the Asperger's or like the PDD-NOS disorder is now social pragmatic communication disorder, which we will kind of go over in a little bit. So, Karina, growing up, did you hear about these disorders like the PDD-NOS, the Asperger's, the child disintegration disorder?
Yes, and I was told back then that Asperger's was more of the mild autism, and then my disorder was the severe autism. And apparently they made a difference that Asperger's was more mild, and
Mhm.
then autism was more severe. And then the disorders just was comparing, oh, this is mild autism, oh, this is severe autism, or this is this or that. But now everyone, well, not everyone, I feel like a lot of people now know that it's a spectrum and it's not one way or another. Back then, I feel like that's how they tried to analyze the whole thing.
So that's interesting. So they said that you were like you had the severe autism.
Right, because I was actually nonverbal,
Okay.
but I did speak and become more independent, but that's what they said. But then with the support, like you guys said, I became more and more independent, and now I'm an adult and I don't need any help.
Right. And I think and thank you so much for sharing that, right? Because I think that sometimes a lot of the clinicians are not very tactful when they provide parents with this information. And sometimes they even say like, your child is not going to be able to do this or your child is not going to be able to do that. Like, how do you know? Like no one can predict the future. Like I never predict whether it's for good or bad. I would never tell a parent, yes, your child's going to speak, or no, your child will never be able to do that. Like, you don't know. Like, all you can say is we are going to work hard on these targets to move forward, right?
Right.
And I think you're a perfect example of that. Look at that. I wish you could go back to that doctor and be like, what did he say? Right? Like, look at me now.
Yeah, he told my mom that I would not be able to drive or do anything, that I would be dependent on her for the rest of my life.
Karina,
That's
you should be
obviously
like,
not
I'm
true.
an RBT. That's all I do now.
Yeah,
I drive everywhere.
no, I would never tell parents that because we don't know, like you said. And there's been a lot of people who are successful who have a diagnosis. So I don't want to tell your child that because that just makes a parent really sad. I
Right.
also don't want to do that. I don't know. My mom cried.
Of
I'm
course.
sure.
Yeah. I don't want to do that to other parents. I want to give them some hope.
Yeah. Okay. Um, so the disorder, and I know there were some comments here about Asperger's being the social pragmatic communication disorder. Again, this is coming from my point of view, right? There's nothing like in the DSM that says that this is this, but me knowing what the older DSM said and this, that's basically what it is. So the social pragmatic communication disorder, a lot of clinicians don't know about. It doesn't get diagnosed very often. It's a little controversial, right? Because there's not a lot of studies on it. It's fairly new. But basically, the social pragmatic communication disorder is the nonverbal part of the autism spectrum disorder, right? So you don't see a lot of the repetitive behavior, like the repetitive movement or that, the fixation kind of behaviors, but you do see a lot of this lack of like understanding nonverbal cues and having difficulties with forming a relationship, avoiding use of overly formal language. So all of these things, right? Like not moderating the tone of voice in certain situations. So these are some of the symptoms that we do see with this social pragmatic communication disorder. What do you guys think, Jen and Karina? Have you guys heard about this disorder? What do you guys think about this disorder overall?
So before you actually told me about it, I didn't know it existed. And being in the field for so long, I see parents that are like, oh, but they don't do this. Like they don't have any of those behaviors. And I feel like this would be wonderful for them to see. Maybe it's not what they thought. And maybe they would have gotten a different diagnosis.
Absolutely. Yes.
So
Yeah, I agree. I have never heard of social pragmatic disorder. I mean, I think it's really cool. I mean, like Jen said, maybe the parents will think, oh, okay, so this is what they have. My child didn't do any of these things, so maybe this is what they have, and they can look into it further and try to understand it.
And I think I'm going to share with all of you, by the way, a manual that we all put together about subtle signs of autism because I think when you have more like more symptoms or or expressions of perhaps the symptoms of autism, it's a little different, right? But when you don't have these full symptoms and you just have subtle symptoms, people treat you differently, right? Like they're not as empathetic with you, which is sort of weird, but that tends to happen. So we put this manual together so people would understand that there are these subtle signs of autism and that a lot of people have the autism diagnosis, but perhaps have never been to see a clinician and have no idea they have these symptoms, right? Um, so have you guys seen situations where, you know, there are like subtle signs of symptoms with your clients, with people that you know, with you, Karina, maybe that, you know, people don't understand and then they judge you based on that?
Yes. So at first, when I actually started making more friends and socializing a little more. They used to call me like really weird because I would say inappropriate comments, but I didn't understand it was inappropriate at the time. Now I do. And then I'm like, oh. And then I have to explain a lot, or if they would be sarcastic. So, like social participation or social relationships, I feel like I have a lot of friends or peers didn't understand me. And at the time, I was ashamed. And I didn't say I had autism or anything. So they would just be like, oh, Karina, you're really weird. I don't know why you do this and that. But I'm like, but I don't understand what I did wrong. So
Right.
yes, I feel like I have experienced this. And then the academic achievement. So what do you mean by that? Do you mean like doing badly in academic achievement, or do you mean like,
Yeah, so
what
so
do you mean by?
just struggling altogether with academic achievement.
Well, I had an IEP, so I feel like most of the teachers are really nice and understanding and followed the standards. Well, they have to. It's an IEP. But I don't know. I mean, what I really struggled, I feel like they would sit down and help me with it, but I struggle with like vocabulary words and certain things, and they had to explain it more, and I had to get a tutor, but I didn't know that would be a part of the social pragmatic communication disorder. I just thought, oh, it's a part of my autism. So I
Okay.
wasn't, yeah.
We have a question here. Is this something like where they can, of course, get better, like going from ASD level 3 to 1? Yes. So we spoke about that, the different levels, but I think they can't, again, this isn't something that's written in stone. People don't like really speaking about this, but I think it just makes sense. If the levels are based on whether you need more support, you know, you need more support or whatever it is, then of course it can you can get to a point where you don't need so much support, right? So yes, I believe that the levels can change. I'm excited to learn more about it. A lot of kids mask so well and they're not getting diagnosed early. Absolutely. Yes, yes. So masking, right? And I think that that goes into our next question here. So true or false, is ABA only for children with severe behaviors? So is it only for children and children with severe behaviors? What do you guys think? We see a false.
this one actually angers me.
Why? Tell us more.
Well, because AVA can be used for so many things. Like I have so many kids that are in the teen group, for example. You would just pass by or you would see them, you would think they're neurotypical, right? Now put them in a specific situation, and then you're gonna take that back, right? But if that's how they are at all times, and no one pushes them, no one, they're just kind of like floating by, they probably would not think that they needed ABA. But once you peel those layers of that onion, you're gonna see that it was because of ABA that now they got to where they are. So that kind of sucks
Yeah,
when they don't need it because you're not
absolutely.
seeing the full picture.
And I think a lot of people think that ABA like creates these masks,
Yes.
right? So we like ABA therapists kind of like create these masks for these kids so they wear it all the time. What do you guys think about that?
If I could wear a camera on me to show how many times we make ourselves malleable, flexible in order to fit ourselves into their lives, they're making me mask. Like I no. That's very stressful because we have so many things to help them be themselves. And we just said it earlier. You could STEM, go for it. As long as you're not hurting yourself, you're not hurting anyone else. And that's not just for kids with autism. Anyone, diagnosis or not, if you're hurting yourself or you're hurting someone else, that's gotta go.
Absolutely. Yeah. I think that ABA therapist because I had this week again, I saw a lot of people this week, but this week I had a kiddo come in and the kiddo was like, throwing things and just bolting and the mom felt bad and she was like, oh my God. And I'm
Sorry.
like this is fine, mom. Like I think as ABA therapists, we experience so much that in some way we normalize it. So if you're gonna find someone that's accepting of these things, it's us because we're there all the time, right? And we see these things happen and it's just, it's just like another day for us. So and again, I mentioned something earlier, and I think it's important that it kind of goes hand in hand with this. And it's like, we I think all of us at some point of your life you wear a mask, right? Like there's certain situations that I don't want to be in, right? And this happens to all of us, but I have to be smiling and I have to be like hi and whatever. That's just the way that life is, right? But guess what? I know I have the mask, so I can put it on when I want to, and I can take it off when I don't want to, right? But if a child doesn't even have that, that ability, not that ability, but they don't get that chance to know, okay, now I can put on this mask, or I can do this, or I can whatever, because of my environment, then we're not really setting them up for any good, right? So I think it's important for us to show them, teach them these skills, and then it's up to them whether they want to use it or not. But at least they have these skills in their toolboxes. All right, so we're almost at the end of our presentation. So whatever question you guys have, please put it here. It's super important that you put it. I'd love to hear your questions and answer these questions as well. So again, ABA, for those of you who don't know what ABA is, it's a science-based approach that really focuses on understanding and modifying behaviors. So in reality, we don't modify behaviors, we modify things that happen before the behavior or after, right? But I think the core of it is that we always want to understand, like, why is the child engaging in this? Or why are they not, right? So we want to understand the why, because without the why, you cannot move forward. You can't do anything. Okay, we have a question here. How can ABA help pragmatic communication disorder? Can they overcome this, or it's something they will have in the future? So what do you guys think?
Behavior is behavior. I could help a frog. Like, um, really, it's behavior. It's not just for autism. It's for anyone, really.
Yes, so it's for anyone. It's not just for kids. It's not just for like really maladaptive behavior. By the way, Jen has she facilitates a group, an ABA social group for adults. And they do the funnest things. So they talk about like these different topics, even some topics that we're like, wait, can we talk about this where they are adults?
Yeah.
You know, but
We are adults. Yeah, the lines
they
get blurred.
It's tricky, but these are adults in the
Yeah.
spectrum. I think everyone there is in the spectrum. And they talk about dating, about making friends, about, how to use money in these certain situations. And then they go once a month to these outings where they get to use these skills that they learn there, right? So here we see how ABA can even help for that. Also, we have a vocational group because we work with the Des Moines Foundation. We partner up with them and we do a lot of this ABA/vocational training so that they know what, how to like go into an interview session and what to say and all of these things, right? We prepare them for that. So definitely ABA is everywhere and you can use it with everyone.
Yes, I agree. ABA is for everyone who needs help. I mean, we can help those who have ADHD or any diagnosis that has behaviors that need assistance. I mean, ABA can be for anyone.
And Karina, I know we were speaking about this like off camera. Um, but I did ask you a question and I said, did you receive ABA growing up?
No, unfortunately, I did not receive ABA growing up. Like I said, I feel like in 1998 or the early 2000s, ABA wasn't like more, how do you say? ABA, I guess it was there, but I guess it wasn't, and not everyone was aware of it. And plus, all I got was like speech and occupational therapy. And my speech therapist is the one who taught me communication and sign language and just everything I know. But I feel like if I did have ABA, it could have helped me cope with my tantrums and my panic attacks and different things I had that my speech therapist did not cover, but I wish I did, but no. A
Yeah,
lot of my peers also didn't get ABA, so I'm not sure if ABA, was as popular as it is now. I'm not sure.
yeah.
No.
And I think it would have helped also your parents, right? Because I think in some way, when the parent is able to have actual tools to help their child, it helps, right? I had a parent also call me not too long ago, and they were like, "What do I do?" Like, I went to a neurologist, I went here, I went, they went everywhere, and this parent was like desperate. So I can just imagine a parent that doesn't have that, right? Like you don't have the tools, and you're like trying to grab everywhere to try to find something, right? When we go in the session, when we meet the parents, and we're like, "Look, these are the tools," whatever, they feel a little like safer, like less anxious, right? Because now we have something concrete.
They felt alone.
Right. Yeah, back then I feel like not that my mom was alone. I mean, she found a community with my cluster class, but for a long time, she didn't know what
Hermosa,
autism was.
¿cómo te fue con la
She
venta?
didn't anything that was going on, and she had to learn through books and whatever the doctor said. My parents just believed whatever the doctor said. And even then, sometimes I feel like doctors didn't know enough. So there she looked everywhere and just found different answers. And sometimes now, God bless my mom. I love her so much. But sometimes she'll still be like, oh, but autism is this. No, like I don't know. Oh, but I feel like because she didn't have a lot of resources and she just figured it out. But God bless my parents. They did everything they could and they did amazing. So,
Clearly.
you know. But now I'm so happy there's a lot more resources and we have online and we have web like this and there's a lot more awareness now as back then.
Right. And I think, just speaking about, I know that some parents come to these webinars, and I think that, like I think all of us who are parents, we always think like, oh my gosh, what is my child going to think about everything, that happened throughout the years? Or are they going to say thank you? Or are they going to, say this or whatever? And then you kind of looking back and saying thank you, mom, right? I think it's great. If you could go back and kind of like say something to your mom, what would you say?
Well, my mom I mean, I would probably call her, and I have told her, thank you so much for everything you did for me. I know it wasn't easy. I mean, she had to quit her job and stay home with my sister and I because my sister had type 1 diabetes. So my mom just had so much to deal with. And I thank her every day for helping us and helping me grow and going to all the IEP meetings and fighting for me and just believing in me. So I'm just happy that, I could tell my mom those things, and that's something I would probably say to her.
You're gonna make us cry.
I know, Karina, I
Sorry.
was ready to cry.
My goodness.
Um,
Sorry about that.
but
No, I understand. My mom's birthday is actually soon. So, it's a good idea. I should probably tell her that.
yeah, I'll
Probably.
send you
Yeah.
a
Yeah.
clip. I'll send you a clip of this and be like, guess what I said on air, right? I think that would be a fantastic birthday gift. And I think it's important because a lot of parents, like a lot of our parents, I see everything that they do, all the sacrifices that they make, right? Paying for ABA therapy, their co-payments or this or that, being there, having to take the child in traffic to here or to whatever it is. And, just know that, your child's going to appreciate it, right? So that's great. That's great that you were able to give us that insight. And I see here, amazing mom. Absolutely. Okay, we have a
Thank
question here. Will insurance pay for ABA without an autism diagnosis? Okay, so that's a little tricky. Medicaid will cover some diagnoses that are outside of autism. I believe we don't work personally with Medicaid. We just do commercial insurance. So right now in the state of Florida, commercial insurance will only cover ABA therapy for autism and Down syndrome. I know that's like a big, yeah, right now that's all, but there are scholarships like the step, what is it, step up for students? Yeah, the step up for student scholarships, which can help, and things like that. But yeah, you do need a diagnosis of autism. By the way, so here's a little caveat. If you get a diagnosis of social pragmatic communication disorder, even though it is known that it was like the the former like Asperger's disorder, you cannot get ABA therapy. It has to be autism spectrum disorder. That's the only way you can get it. But that doesn't mean that you cannot get ABA therapy. You would just have to pay for it, on your own. You would have to do it through private pay.
Right. I had a client before that the parents were paying privately, but I heard it's a lot per session. Is that correct?
I mean, it depends. A lot of it, there's a lot that goes into it as well. So we have to kind of put that, in a balance. But definitely like we always try to work with the parents and find other alternatives. We could do like mental health, do parent coaching, like there's other things that we can do. So if any of you have any questions about that, you can always contact us and we'll work with you. Jen is usually the one that speaks with the parents and we all kind of work together to find something that we can offer you so you don't stay without anything. Um, Okay, so kind of going back to this, not only does ABA work with behavioral challenges, it also works with communication, functional communication. We're not speech therapists, but we do a lot of the VB map and verbal communication curriculums, and we do more of that functional communication. We also work on daily living skills and play skills, right? Because our goal really is for the kiddo to or for the individual to be able to be independent, to not need us. Just like Jen said, right? We're in the job of not being in a job because we want the kiddo to be independent as much as possible. Step Up will cover ABA only if the scholarship is for unique ability students. Absolutely. Thank you for clarifying that. So Step Up, it has to be the unique abilities for students. And you need a diagnosis, but not a diagnosis of autism. Jen, yes.
It could be anything, like a
Yeah.
speech delay,
Stuttering, I think.
literally anything, any diagnosis that was given, they have a huge list. So it does not have to be autism. That's like our saving grace. And they'll give up to like $10,000 a year. And if you split that up nicely and maybe they only need like social skills, for example,
Mhm.
that's enough to cover.
Absolutely. Yeah. And and again, if you do need a diagnosis and your child is showing symptoms of some type of diagnosis, we also offer that at our clinic. We do psychological and psychoeducational evaluations. So that's something that we can do so that you can qualify for the Unique Abilities Student Scholarship. And it's not based on income. We always get that question. So you could be like, potentially like a millionaire and still qualify for this scholarship. So yeah, so ABA, we work in groups, we work on household chores, we work on all of these different things. So it's not just on these maladaptive behaviors. So before we go into our last slide, what do you guys want to add, Karina and Jen, about ABA and the way that we kind of provide these services? Because I think people still have like a lot of questions about what ABA is and can ABA help with this? And I think it's like a stereotype that, that ABA is like just for autism, or that ABA is just, for little kids or for really severe behaviors.
I could say my experience. I feel like I've dealt with everything on the spectrum. I have had kiddos spit their poop at me, right? Those sessions are going to look very differently from my adults that I'm giving dating advice to. It'll be very different. No matter who you're with, you are meeting a whole new person. Okay, something that with your other kiddo, it's not going to work with the 2-year-old you just got. And I think a lot of people think that you're just sitting at a table and you're showing them flashcards and they're there the whole time. Absolutely not. If someone is there that you have or have worked with and that's all they do, get someone else, right? That's not what it's supposed to look like. We will look like your child's best friend. If we walk in and they're not just so excited to see us, I don't know, something's up, right? We are there to sternly help them as like little best friends. That's how I see it. It's we always keep them in mind, and they're the first ones. Like, we'll go to a store, oh my gosh, this person would really, really love this, and they occupy our mind all the time. And you'll see it. You'll see the love that we have for them. And if you don't see that, then I think that's an issue.
For sure. I do agree. Yeah. We spend sometimes a week just pairing with the client. First start with them and we observe them and we see what do they like. Oh, what could we do to make the session more productive? Like, okay, so first they do work and then they earn the highly preferred reinforcer or activity that they like to do. Like, you actually know your client. One of my clients loves squeezes and hugs and he loves cookies. So then what do? I said, okay, let's do your work first, and then you get a cookie. Or then you can spin, you can run around or do whatever you want. So it depends on your kiddo. And if, yeah, they're not happy to see you and they're not like hugging you or squeezing you or trying, to invade your personal space almost a little bit. At least that's one of my kiddos. He's very lovey-dovey, but they're not happy to see you, then something's up. But no, that's not what ABA is about. I don't just sit at a table. I'm actually consistently running with my kiddos. I'm always doing naturalistic running. I'm always running around. I'm sweating at the end of it. We don't just sit down because a lot of my kiddos, well, I guess they're younger, but they can't sit down longer periods of time. I'm happy if they just sit down for 5 minutes, get up or anything. So no, that's not what ABA is. I'm always running around and, oh, you want to play with this? Okay. Yeah.
I
Just
love how
observing
she
them and
said consistently running.
Yes.
I'm always consistently
I
running.
mean, I am. I mean,
So we're
not
getting
like running, walking around, just observing them, seeing what they do and you know, especially if
you're
they're
on your
little ones,
feet.
especially.
You're on your feet on
Yeah,
your
I'm on. Yeah, and I have
um
like an apron I put materials in, so
I know I always see Karina with an apron. I love that. Okay. Questions. We're almost at the end of our presentation. I know it went by really quickly. Usually when it's fun, it goes by quickly. But what questions do you guys have? Questions about autism, about ABA, about anything else, things that you may want to ask Karina, want to ask Jen, you want to ask me. We're super open to answering any question. And as you guys are jotting this down, I kind of want to put this out there that if you've met one person with autism, you have only met one person with autism. And the reason why I say this is because it's really easy to say, oh, you meet criteria and whatever, we're going to put you here with this diagnosis. But everyone is different. Everyone is an individual, right? And I think that we have to treat everyone like that. It's not like, hey, I just went to his presentation, I learned about these symptoms. I know you have autism and I know you. No, you don't. You don't. You don't know that person, right? So I think we have to understand that. What do you
I
think,
worked
Karina and
with
Jen?
twins. I worked with twins. They were both diagnosed and they couldn't be like any more different. Like it was day and night. So, I mean, how much closer can it get, right? Like you'd
Yeah,
think that they're in the same household,
they're
that the
twins, share the
environmentally
DNA, right?
it's the same, but no.
Exactly. I have a question here. Maybe if the ABA is complete, oh, sorry. If the ABA is complete as the child gets older, as in completed the program, do you see kids having to go ask into ABA later in life? So do they go back? Okay. So if they get discharged from ABA, do you see them come back as teenagers or adults? I think that sometimes we've had kiddos that we've worked with in a very early age. We discharge them because that's it. They're good to go. They don't need ABA anymore. And then later on, perhaps in adolescent years or things like that, things start coming up and parents are like, oh my gosh, we don't know how to handle this. And they have come back to therapy. So that is something that can happen. Absolutely.
I mean, the teenage years are a whole new ball game, okay, for everybody.
And then adult years as well, because then they age
Oh,
out of school and they're not going to school. And then you're like, do they go find a job? Like, do we do this? Like, what do we do vocationally? So I think every, age is like a different phase. So definitely that's something that can happen. And don't feel bad if you're a parent where your child has been discharged and now you're coming back to therapy. I mean, it's something that can happen. How many hours per week is ABA typically recommended? Good question. So,
I feel like it depends, right?
yeah. Yeah, it definitely
Yeah.
depends. I think some doctors and thankfully I have not seen a lot of doctors do it lately, but back in the day they used to do it a lot and it used to really like boil my blood because they used to all have this standard 40-hour, right? Like 40 hours, your child needs 40 hours. And I'm like, first of all, you're the neurologist, respectfully so, but you don't know about ABA. We have to do a thorough assessment to find out how many hours a child actually needs. Who are you to tell us to give the child whatever amount of hours? So there's really not a standard time. And I would say run away from companies where you call and just by you speaking to them, they're like, yeah, I can give you 15 hours or 20 hours or whatever. It's impossible. You have to do a thorough assessment to see what the child needs.
There was also a question I saw that said strategies for supporting children with autism at school.
Okay, okay. So I wish we would have gotten that question before, but really quickly, Jen, what do you think are some strategies that we can use with kids, I guess, with autism in a school setting?
I think communication with teacher and parents, that's huge. We start off there. But in school, you really have to be there, see what the function is, what do they need, and then help them out. If, for example, if they're fidgety, if they are, trying to get up every 2 seconds, like what do they need? Do they need movement? Okay, let's strap a little bungee cord on your chair. Oh, like they're acting out in class. They're the class clown. What do they want? They probably want attention. So call on them when they're behaving good, right? There's so many things, and it's not a one answer fits all. It really depends on the child. That's what we're there for. We figure it out. It's our little puzzle.
Absolutely, yeah. You have to kind of be there and do the ABC data and kind of see what they need. Like if well, there's elopement behavior, why are they doing it? Because they need a break. It's tangible. Yeah. It really depends. So that's something you would have to observe the child for. I mean, I'm not sure there's like one answer to that.
Yes, perfectly said. Let me see how many hours. Okay, so thank you for sharing your thoughts and experiences. Great info. Have a good night. Okay, perfect. Thank you, Catherine, for being here. So I think that's it. Again, if you guys want to be part of the newsletter, you can always, take a picture of this, and this is a QR code to be part of our newsletters. We do these webinars once a month on different topics. I think for the next few months, we're going to just focus on autism, but we do it in different topics. So thank you, ladies, for being here. Thank you, Karina, for sharing your story. Thank you, Jen, for always, showing that support and just sharing your experience. Thank you for all of you for really being here, and that's it. I hope that you all have a great rest of your night, and I will see you guys on our next webinar. Bye.
Mhm.